afternoon. Welcome to Money Matters. My name is Kimon Hatza, and I'm a business attorney at GrowthCounsel in Philadelphia, Pennsylvania. Today, we're continuing our special series on life sciences and technology leaders in the Delaware Valley. I focus my practice in the areas of business transactions with a focus primarily on companies in the life sciences and technology space. Before we get started, I would like to remind our viewers that from time to time, financial issues related to life sciences, technology companies or matters may be discussed on the show. These discussions are not and should not be viewed as financial advice. Moreover, since the show is pre-recorded and shown at a later time, the information may no longer be current. You should always check with your financial advisor before entering into any financial transactions. I'm happy to have with me as my co-host this evening, Charlie Huntington. Charlie's the head of public relations at Life Sciences PA. Life Sciences PA is the voice of advancement for the life sciences in the Commonwealth of Pennsylvania. Charlie, thank you for co-hosting today.
You're welcome, Kimon. It's great to see you.
Good to see you too, Charlie. I was wondering if you might take a minute, Charlie, and talk to our viewers about some upcoming events at Life Sciences PA.
Sure. Well, if it's all right with you, I want to recap what happened at the end of September with Life Sciences Future. So Life Sciences Future was held over 2 days, September 27th and 28th. And I've been coming to these programs now for 20 plus years, and I have to say this was the best one ever. They had multiple stages, which kept people interested in topics that would interest 1,000 people and topics that would interest 25 people. They had reverse pitches. We heard a lot about how tough funding is right now, which seems to be a continuing theme, and also a lot about gene therapy, which is hot. So there are some great upcoming programs, both here and as far away as Pittsburgh. I want to highlight one program in particular, though. December 14 is the annual holiday mixer. And that's one where no matter whether you are a life science CEO, whether you are a local politician, whether you are in transition right now between jobs, we tend to see literally hundreds of people show up in Life Science PA's headquarters in King of Prussia, in the old GSK facility there, their Upper Merion facility. And it just is an incredible time, and it's a great way to ring in the holidays. So I would commend that to all of our viewers and hope to see you there.
Always a great event. And in terms of what you said at the outset, financing always being a hot topic among folks in the industry. We have a terrific guest tonight, happening to be in the investor space, and we don't always have those folks on the show as guests, so I'm excited to bring him out. Before I do, however, I wanted to let our viewers know that if you'd like to know how to ask a question for us to answer on a future show, watch this short video to see how you do it.
You can have your questions answered on Money Matters. Please go to our website, money-matterstv.com. On our homepage, click on the banner on the right that says, Send us your questions. While you're on our website, you can find information about our host and guests, as well as show notes and links about this show and past shows. Money Matters is also available as a podcast on iTunes and Stitcher, so you can listen to Money Matters while you're on the go. That website address, again, is money, MONEY, -matters, MATTERS, TV.com.
It's with great pleasure that I welcome our special guest today, David Owens. Mr. Owens is a founder and general partner of Bowman's Tower Venture Partners, LLC, an investment fund making direct equity investments in preclinical companies to drive the translation of innovative ideas and technologies into successful businesses and future exits. He helped establish Bowman's Tower in 2022 after nearly 30 years of experience as a leader in the pharmaceutical and biotechnology industries, with extensive expertise in the commercialization of biopharmaceuticals and biologicals. Mr. Owens currently serves as president and CEO of Biologics MD, an early-stage drug development company, and as a board member for Third Law Molecular, a transformational chemistry company, each of which is a portfolio company of Bowman's Tower Venture Partners. Early in his career, David held commercial operations roles at Genentech, Merck, and Abbott Labs. He moved on to executive positions with Aventis Pharma, now part of Sanofi, and King Pharmaceuticals, now part of Pfizer. David has been an active private investor and angel investor since 2009 and was previously a member of both the Mid-Atlantic Angel Group Fund No. 2 and the Delaware Crossing Investor Group. He's a graduate of the University of Wisconsin School of Pharmacy. David, welcome to the show.
Thank you, Kimon and Charlie. Pleasure to be here with y'all.
David, what first attracted you to a career in the life sciences?
Well, I always had an interest in chemistry and also in biology, but I didn't have the fortitude to go to medical school. It seemed like an awful long time for me. A couple of my brothers are in that space. So I looked at various different options, and I worked in a professional pharmacy when I was in high school. And the idea of being able to work with medications and therapeutics could help bring people comfort and correction in illnesses was always very attractive to me. So I started in my career at the University of Wisconsin in the School of Pharmacy. But as I was in pharmacy school, I realized that I probably didn't want to just stick onto the side of working as a provider of medications, but more of an innovator, and to get involved with the pharmaceutical industry. So that bell rang in my head probably when I was about 20, 21 years old, and I've been doing it since.
How would you say that your early experience with larger pharma and biotech companies, as well as your more recent experience as both a private investor and an angel investor, helped prepare you to be both a founder and partner at Bowman's Tower?
Well, thank you for that question. I actually am going to correct a statement. I've been in this industry for 40 years, which is a lot longer than I ever thought I'd be looking backwards. But I spent my first 25 years of my career working for very innovative pharma and biotech companies, predominantly in commercial roles, product manager, head of marketing, vice president of marketing and sales, and also in new product planning, where I was helping decide how the products were going to be developed and launched for innovative new indications and treatments of diseases further along in my career. And then later on, I became more in the general management role of a number of different companies and business units. So this gave me the background and the knowledge of how to make decisions about where to invest dollars in investing in new therapeutics, how to advance them, and how to get them funded within a company, but also seeking partnerships and strategic partnerships externally. So the first 25 years of my time was spent doing that. In 2009, I semi-retired after 3 successful exits. 3 of the companies I had worked for had been acquired, and I was able to squirrel away some money that I could go into start doing some of my own things. And so for the last 14 years, I became an investor. And in that, I learned the knowledge of how to make careful reviews of businesses, evaluate technologies, and try and make calculated investment decisions. It didn't come easily. There were a lot of times where I spent a lot of times making some false assumptions and so forth, but you learn along the way. And the more I got involved with it, the better I think I got and the more confidence I gained. So for the last 14 years, I've been pretty much an investor and also working as an operator and board member for a number of these companies. The formation of Bowman's Tower Venture Partners was a logical extension to do this with other like-minded life science professionals and investors. and people who have want to do this together and leverage our total experiences. So the people that are generally partners of our group are all ex-pharma or biotech CEOs, big, small, medium-size, people who have held C-level positions within companies, both in development and in other areas, commercial and so forth. And we band together to try and make informed decisions on how to help companies grow within the Mid-Atlantic and Northeast.
What would you say is the most challenging aspect of your role at Bowman's Tower Venture Partners?
Well, like I said, it's a collection of life science operators and investors who are interested in contributing to the expanding the early stage community. But we're also all volunteers. We volunteer our time and our efforts until we actually invest in a company and get operationally involved. So all of the upfront work in doing the screening, the due diligence, is done by partners that are interested in a particular company or technology. Most of our partners have some other kind of role. A lot of them are semi-retired or acting as consultants or advisors. But trying to get everybody behind something to do the proper due diligence and to make sure that we can put a concerted effort into understanding the technology, the viability of the technology, the ability to make an important investment that will help the company go forward takes a little time and patience. So that my other general partners and I do most of the initial screening, and then we have to bring in other of our partners to help get involved with the process. It takes a little work.
Yeah, which leads to my next question. Early in your career, obviously, you're either a full-time, executive with a pharmaceutical company, or maybe a full-time private investor or angel investor. Now it seems like you're wearing even more hats. You're an investor, and you have to do all this. You're volunteering time. You're doing this upfront due diligence, but you're also an executive for some of your portfolio companies or a board member for others. How do you find the bandwidth to do all of these different things at once?
Well, I kind of started that process in 2009 because when I started investing, I was doing a lot of that, but on a smaller scale. I wasn't doing it with 10 or 15 different companies. It was a couple different companies. And so I learned how to multitask and kind of prioritize my activities and work efforts on things that were important at that one particular time for any one company. And as I moved along, I realized that I could multitask and I could work and collaborate with others because I would have a good core of people working around me that could help do all of the things that we need to do to advance our businesses. What we're trying to do with Bowman's Tower Venture Partners is scale that effort. We're trying to do it in a larger way than what I had done individually or with a couple of angel groups. That we would do this as a collaborative effort. And so we're with enough good people around that are interested and are like-minded in what we're trying to do. It's actually a lot more simple for us to try and get that done. Although it is, the bigger we get, the more stressful it gets.
Thank you.
David, tell us about Bowman Tower Venture Partners, please.
So as I mentioned before, the partners are generally a group of successful life science executives and investors who are like-minded in that they want to help and invest in early stage companies, areas that some people call the valley of death, where you have some really good ideas, but then getting them across the finish line and to the next level of investors can be very difficult. So many of the partners that are in our group have invested with me before or have invested with others in early stage companies, mainly life sciences. We have a preference towards early stage drug development because most of us come from that space. And it gives us the opportunity now that we're farther along in our career that we can still stay in the game. I like to use that term with everybody. We like to be involved with the early stage companies. We like to help the innovators. We like to help the people that are bringing new technologies that may be foregone from larger pharmaceutical companies from developing because it may be too small or out of strategic focus at that point, but still meaningful as a new therapeutic to help them get to that next level. And hopefully by giving them some help and guidance, both in experience and also in financial benefit, we can help them move to the next step. We can stay in the game and with all good luck have potential financial rewards for all parties.
Thank you. How you mentioned the areas of focus. So I want to look at how would you identify appropriate investments for Bowman's Tower Venture Partners?
We're appropriate investments. Well, what we've been doing is most of our investments opportunities come in from our partners, come in from people who are either working in fields that are ancillary to the actually life science investment fields. They could be attorneys, finance people, people that are working as their own advisors and consultants to early stage pharma companies or early stage companies. And we also have a number of we also have a number of angel groups that we collaborate with. As you heard before, I was involved with the Mid-Atlantic Angel Group Fund, with MAG, and also with Delaware Crossing, and I've had a long relationship with Robin Hood Ventures and others actually up and down the Mid-Atlantic shore. So we get a lot of our deal flow directly from them, and we have a number of family offices that we work with as well. So we have access to plenty of opportunities. The question is finding the ones that really kind of fit what we're interested in investing in.
Thank you. What about proprietary IP? Is that important?
Critical in life sciences, especially in pharmaceutical drug development. You really have to have IP. We're looking for companies that have licensed the IP already from an institution, are close to filing their own IP, if not have already done so, and then also if there's some type of collaborations where they could have access to additional IP to help benefit their organization, we help them try and find that as well.
So does commercialization typically require FDA approval?
Yes, well, for drugs and for medical devices, absolutely. The ultimate goal is to get regulatory approval with the lead product or program in the US and then potentially also in other markets. However, our model is to invest early, real early, and then hopefully get to a point where we can show human proof of concept in the early clinical trials and then be an acquisition target for larger strategic partners. That's really the model that we've been following for the last 14 years. And it's been also the model that actually exists within the pharmaceutical industry as well. Not many companies do their own R anymore, R standing for research. Most of them do their D, development. So they do the D and R&D. We're doing the early stage R, and hopefully we can get partnered up with a company early on.
Thank you.
David, is Bowman's Tower financed solely by its partners?
Yes, at this time, there are no institutional partners with us. It's all individuals that are accredited individuals. So they have to be accredited investors, a certain amount of net wealth that allows them to do that. And then each of the investors makes their own decisions as to how they're going to invest. We don't require anybody to get in if they're not interested in it. And even though there may be some minimums we have for investing in a deal, people can put in as much as they want. And that allows us to really, in some cases, ramp up our investment potential.
Is there an amount beyond which you won't invest in a particular deal? And if it makes sense, would you bring in, other investors? If it requires an investment beyond which you guys won't do, yeah.
Yeah, we like to syndicate. Yeah, I'm sorry for interrupting, but we like to syndicate. We like to syndicate.
I'm sorry. Go ahead.
We like to syndicate with other smaller venture groups, groups such as BioAdvance in Philadelphia. It hasn't been one we've done recently, but they're a group that would be involved with family offices. We have a number of family offices that we're connected with as well. So they're making investments on their family trusts. And like I said before, we know a lot of the angel groups, both in the Philadelphia area, but all the way up into Boston and really across the country. We're involved with the American Angel Capital Association, so we have access to the wide group of angels across the country. Our usual investment size is somewhere between $500,000 and $1 million by ourselves. But with the syndicate, we can get that total investment upwards to several $1 million for some of these early stage companies.
And since you're investing during the preclinical phase, at what point are you looking to exit the investment?
Human proof of concept is the ideal spot. Now, human proof of concept, first human proof of human concept, for that in layman's terms is anytime you're getting through phase 1B, which is generally a safety study, but it's a safety study in patients. Phase 1A is safety in subjects, which are normal patients, normal subjects. But if you can get through the safety data and the safety studies in phase 1B and show that your product is safe at a dose escalation range, and you may have some hints of efficacy, that is probably the earliest that we would hope to get into an acquisition or an exit. But we can also get it as far as phase 2. But never into phase 3. If we're in phase 3, it's a lot bigger than we're ever going to get, because those are the large clinical studies that require a lot of capital.
Mm-hmm. In light of the fact that you're taking a significant risk by investing at an early stage in the portfolio company's life cycle, what kind of a return are you typically looking for?
Well, a multiple on our investment. Historically, my exits that I've had over the last 9 years have, on the low end, the lowest I got was a 4x return. I haven't had any failures yet. There's one waiting for me, I'm sure. But 4x of my invested capital on one end, and at the high end, I got a 22x. That 22x was, I also had a lot of early stock that was founder stock in the company, and stock options as being a board director that allowed me to get, without investing money, to get additional shares. So getting a 22x in an investment is a pretty nice premium. And I have a number of friends that are venture capitalists, so they'd love to have that more frequently. But
I'll bet.
I'll stick something with a 4 or 10.
That's great. What other things, you mentioned some of these things in answers to some of the early questions, but what other things does Bowman's Tower bring to the table that maybe sets it apart from, a typical preclinical type investor? I'm thinking about things like, operations expertise, team assembly, that sort of stuff.
Right. As I mentioned, we have a number of our partners are attorneys, our finance people, our ex-CFOs, financial advisors that worked in the pharmaceutical industry, people who have retired and still want to stay in the game. So we have individuals that have run very big clinical programs, MD, PhDs that have had access to running big clinical programs, lawyers and so forth. Commercial people that can do a lot of market research and evaluation. So we'd like to bring that suite of skills to any one of our investments so that we can help them make some of these early decisions without them having to go out and acquire that technology, either by paying for it through a big vendor or supplier of such a skill, or trying to hire in people. That has been really attractive to a lot of the companies we've worked with. We have one particular company that we're involved with right now that we're offering legal and financial and board and commercial expertise, strategic expertise, and that's very beneficial to this entrepreneur.
That's great. Charlie?
Thanks. I know our time is limited here. David, I'll ask you, many life science entrepreneurs in the region get hung up over, we seem to be less concentrated in terms of funding sources in this region than we are in other regions. Do you think there's any validity to that complaint when you look at San Diego, San Francisco, Research Triangle Park, or Massachusetts?
Well, certainly for the larger venture groups, the ones that have the multi-billion dollars of assets under management, we don't have many of those, if any. The last one that we really had was Quaker BioVentures, was one of our larger VC groups here in Philadelphia that got involved in early stage drug development and investing. So that's a legitimate complaint. However, we have a lot of supportive groups that can be very helpful in these early stage financing groups, meaning funding sources such as groups like PACT that will work with entrepreneurs. Certainly the Life Sciences PA, which you're a part of, Charlie, and also BioNJ and the University City Science Center are helpful in bringing in investors from some of these other areas and also local investors to help some of these companies bridge that gap. But I think that's the one thing that as we get larger in the community of life science drug development, such as Boston and the Bay Area, two areas that I've lived in the past, we'll have the money follow in as well.
David, I know I want to get the show back to Kimon in just a minute, but in 30 seconds, can you tell us, have your investments been focused all around the greater Philadelphia area? Have you ventured outside of that?
We're pretty much in the greater Philadelphia, mid-Atlantic area, but we also have in New Haven, Connecticut, and we have looked at deals in San Francisco and also up in Boston. So the idea is that we just want to make sure that we're looking at the right technology that fits our footprint, and where it exists is probably not as important, but it's nice to be closer to the entrepreneurs so we can work with them collaboratively.
David, we have maybe about a minute. I just wanted to ask you, what do you think are the biggest challenges for the greater Philadelphia area in terms of sustaining a vibrant life sciences community?
Well, the challenge that we had over the last several years was lab space and incubator space, but there's a lot of work that's going into getting that improved. So I think that's been a big success. A number of companies have done real estate companies have been working hard to get that built up and provide more of that. We have all the other elements. We've got the science, we've got access to talent. We have a very responsive early stage investment groups and supportive groups. So I think there's a lot of it we have. We just need to get a little bit more of the capital and also some government and state support, realizing that life sciences is critical to the market. They say that, we have a can-do attitude here in Philadelphia. I think that's part of that Philly thing that we talk about all the time. So we can do it.
All right. Well, thank you so much. That's about all the time we have. I want to thank our special guest, David Owens. David, thank you. That was terrific.
Thank
Charlie,
you.
Thank you again for co-hosting. The next guest on Money Matters is Matthew Cullison, who's the Executive Managing Director at Newmark. Appreciate you all for watching, and we'll see you again next time.